Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. This month's theme is trauma. Before we begin, one of the unique attributes of trauma is that it's not limited to a body system. Trauma can involve multiple systems as well as multiple body areas at once. For this reason, it is important to consider the entire exam. Let's begin with our first case of the month of March. Today's example is an approximately 2-year-old female entire possum who presents following vehicular trauma. We're going to focus our attention on the ventrodorsal and left lateral views. The first thing that we notice is that there are 4 mineralized fetuses, 1, 2, 3, 4, that reside ventral to the caudal abdominal wall and are surrounded by gas. This is consistent with fetuses within the marsupium or pouch. Let's take a look at the thorax. The cardiac silhouette is shifted leftward. The pulmonary vessels and pulmonary parenchyma are normal. We do observe smooth remodeling along several ribs, and this likely reflects healed rib fractures. Additionally, we see some mineral in the association with the right clavicle and also with the left clavicle. These can indicate bone fragments from previous trauma. However, in the absence of soft tissue swelling in today's exam, acute trauma is considered unlikely. Let's move caudally to the abdomen. We observe that the patient has a relatively thin body condition. This likely contributes to the relatively reduced serosal contrast amongst the abdominal viscera. What we do appreciate is that there is gas distension throughout the small intestine and feces within the descending colon and rectum. If we take a closer look at the musculoskeletal structures, we appreciate that there is a gap between the cranial portion of the left epipubic bone and that portion that is fused with the pelvis. We see this fragment cranially and ventrally displaced from the normal path of the right. There is possible soft tissue thickening in association with the caudal margin of the cranial fragment. The margins of the fracture fragment are sharp. That suggests an acute process. So, in conclusion for this patient, we have an opossum carrying 4 joeys or juveniles. We have loss of serosal contrast and moderate generalized gas distension of the intestine. The generalized gas distension of the intestine is likely due to the anesthesia required in order to obtain these images and would be consistent with a functional ileus. Additionally, and most significant finding in this exam is the cranial displaced left epipubic fracture. This fracture may compromise her ability to support a pouch for the future of her reproductive life. Be sure to view the full report associated with this case. Thank you for listening, and remember, it's your case, so please post questions on social media.